Hi there, this is Steve Reams, and welcome to ACMS Pearls of Great Value podcast. It's the new year, and we decided that we need to get out in the field and start interviewing some of our members to find out what is new and happening in the medical community. And today I'm really pleased to have Dr. Katherine Lee of St. Luke's Health System and Children's Ophthalmology be with us today. And Dr. Lee is going to share with us her personal journey from physician to patient and how it changed the way she practices medicine. So welcome, Dr. Lee, and share with us.
Thank you. Last year I had the misfortune to have a severe illness. I had cancer. My descent from good health was pretty steep. I had 6 months of very intense treatment, and fortunately my ascent back to good health was also steep, and I'm doing nicely.
Great.
My experience as a patient has definitely changed how I practice as a physician.
How so?
Well, I began to realize as a patient, as a physician patient, that I had much more access to my medical information than my patients ever enjoy. And I'm trying to level the playing field a little bit.
Yeah. So tell us the story. How did you kind of come to this awareness?
Well, I was treated here, and so using my physician access to the electronic record, I had all my information. I had all my labs, all my radiology reports, my operative reports, everything. And that was really helpful to me in my journey through my treatment. I really wanted to own my illness, and having all the information allowed me to do that.
Sure. Did that present any problems in the relationship that you had with your treating physician?
No, I think sometimes he was surprised. He eventually got used to the fact that I almost always had the information before he did.
Okay.
But I stole his thunder a few times when things were really good. And when things weren't going so well, I also knew that ahead of time. But to me, that was my preference. He was wonderful. I respected and revered him. He took very good care of me. But I didn't really want him breaking news to me.
Sure.
I wanted to get that on my own terms. The scenario of my going in and him sitting me down and telling me about my chest CT scan, that really did not feel very natural to me.
Okay. So you came out of that experience, you were treated successfully, thankfully, recovered. How did you, when you went back into practice full time then, how did that change the way you thought, well, maybe my patients would like more access to their information?
Well, I began to try to figure out how I could give my patients more information. I'm a pediatric ophthalmologist, so we don't have a lot of labs and imaging. What people really want to know from me is what I think, what I've seen in the exam, and where we're going. So they really want my note.
Okay.
And so I tried to figure out a way that I could provide patient note in real time.
Okay, and so what did you find? Are there other people doing this, or is this a revolutionary new concept?
Well, it's a very simple concept. It's, like most of my good ideas, it's been put forth by others. There is a movement called the Open Notes movement,
Okay.
which I became aware of when I was a patient, where access to patient notes is available on electronic portal. We don't have open notes here at St. Luke's, so I've tried to develop a little bit of a workaround so that my patients can experience an open notes style practice without the institution having adopted that.
Great. Well, that sounds like an interesting topic to delve into further, and maybe at the end of this month we'll come back to you and say, how does this work in real time as a physician? Because next week we're going to be talking with Dr. Mark Chasen, who's the Chief Information Officer and, of course, in charge of the technology here right at St. Luke's Health System. So thanks again for being with us today, and we'll see you next time on the podcast.